The first thing that's important to know is how you define an outbreak. Not all coronavirus cases are tied to outbreaks, in fact, many are not. A lot of it is just more randomized community spread. But the outbreaks are of course a big concern, which is why the state attempts to track them. Here are the criteria for something to be considered an outbreak. First, there have to be at least 2 people who've tested positive for COVID. Second, the symptoms of those sick people have to have started within 2 weeks of each other. Third, there needs to be strong evidence that they passed the virus to each other in a setting other than within the same household. So basically, if multiple people get sick at the same time and we're in the same place, that could constitute an outbreak. Over the course of the whole pandemic, restaurants are by far the #1 source of outbreaks, with 151 reported to date. Corporate agriculture is number 2, followed by construction and then childcare. The most recent report is for the first week of November, though the results could change as more data gets funneled to the state. There were 19 outbreaks in Washington that week. The biggest culprit, childcare facilities with 4. Construction, colleges, offices, and the military each accounted for 2 outbreaks. And several other settings had 1 lone outbreak during that week. Interestingly, restaurants only caused 1 outbreak in this report, and private events, none. But again, outbreaks aren't always easy to track, and they can in fact take some time to identify. One other thing, this report purposefully excludes outbreaks from long-term care facilities like nursing homes. There have been more than 1,000 such outbreaks this year. If you want to look at that full list, text the word outbreak to 509-448-2000. We'll send it right to your phone. Casey Decker, Crime 2 News.